Good evening and welcome to the Budget and Finance Subcommittee. Today is Wednesday, August 25th, 2021, and this is the bi-weekly Budget and Finance meeting. Members that are here today: Councilor Large Anna Levy, Council President LaPlante, District F, and myself, Councilor District D, Giovanni Rodriguez. Councilor Abdu, he's not present today. He have other duties that he need to be at in his work. Councilor Payano probably going to join us later during the meeting. Pursuant chapter 20 of the Act of 2021, this meeting of Budget and Finance Committee is being conducted via remote participation, not in-person attendance of a member of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings and provide in the order. A reminder that a person who would like to listen or to view this meeting while in progress might do so in the following access location: Facebook, Lawrence City Council page, and YouTube, Lawrence City Council page. Councilor Payano, he's just joined us for the meeting. Welcome everybody. So we have Councilor Levy, Councilor Payano, and Councilor Giovanni Rodriguez present today. Thank you, Councilor LaPlante, for being here as well for the quorum.
You're welcome. I'm happy to leave. Do you think that you'll have will there be any need for me for later? Does anybody need to buck out for any reason that I might be needed? Or do we think we're going to be fine for the rest of the meeting, Mr. Chairman?
I think we will be okay. Is anybody else going to leave in the middle of the meeting? We have two items that we're going to discuss tonight.
Feel free to shoot me a text if you need me for any reason. Thank you and have a good meeting, everyone.
All right, thank you so much. So we have two items on the agenda tonight. Item 16921, which is order to expend grant from the HRSA loan, HRSA local committee based on the workforce to increase COVID-19 vaccine access. This grant is for $1 million. It was put together by Marta Velez, the HHS director. Councilors, we have $1 million that is asking us to spend the grant in order to maintain vaccination access. There is any questions on item 16921?
Mr. Chair.
Councilor Payano.
Yeah, so I know it's $1 million to extend vaccination, but there wasn't anything in our package that described or articulated how that $1 million was going to be spent.
We have the authorization order, whereas the City Council on Aging has been aware of $1 million, and so far so on. We have 4 points that typically describe as of what we need this money and the legal portion of it. Did you have the opportunity to go through that?
I did.
Okay. So is Marta Velez here with us tonight? I guess she haven't joined yet. Probably she will. If it's not, she will be at the City Council at the full council meeting. The vaccination effort are a reality in the city of Lawrence. We wanted to have everybody vaccinated, and the rate of several communities within the city need to increase. And I think this is an important matter and money that we need to use. We have the use for. Do you have an issue of sending this money over, probably pending documentation or clarification of the grant as of how we're going to be using that?
So, I mean, Mr. Chair, like in other motions in the past, that folks have come up to us sort of asking for something similar. I've always said that I'm a big believer that these type of discussions need to happen at the committee level, where we can go more in depth before we send it to the full council. I mean, like the actual purpose. Maybe not purpose isn't the right word. What the headline of this is, it doesn't seem like it'd be something that would be against, right? Like it's to increase vaccine access. But I think it's not a $10,000 grant or even a $50,000 grant. It's $1 million grant. So I think that if we're going to be basically authorizing this expenditure, we should have some type of conversation on how that $1 million is going to be spent. Is it $1 million going to be spent to employ people to knock doors? Is it $1 million for employing nurse? Like I don't know, right? So
Okay.
I think that piece, if at least there was some type of document explaining that in front of us, that would have been enough for me to we could wait for Director Velez at the following meeting.
Understood. So we have one document in front of us that is the order authorizing the expenditure of the grant fund for by the allowance counseling agent. It reads, whereas the counseling agent has been awarded a grant of $1 million from the HRSA local community-based workforce to increase COVID-19 vaccination access. Whereas the purpose of this grant is to increase vaccination access and rates from the Hispanic resident to 85%, utilizing grassroots outreach and education, as well as support the mobile vaccination clinic in communities locations. Whereas the department is intends to use this grant to support hiring staff to assist with the developing and disseminating COVID messaging, as well as to confirm the commitment, identifying roles and responsibilities of community-based partnership and alliance in order to work more efficiently towards the closing of the disparity of vaccination rate. I think that it's telling us here on this memo that the purpose of this grant will be utilized to reduce the gap between the Hispanic community via a grassroots campaign and education campaign. So I think that the document that we have in front of us is have a lot of information as to how they're going to spend the money.
Through you, Mr. Chair. So I think you are right that the document gives us some information, but for example, you are not able to tell me how much of this is going to be used to employ people. You know that some of it is going to be used to employ people, but we're talking about $1 million. Is that some of it 50,000, 100,000? I'm sure some of it is going to be used for marketing purposes. How much of that is going to be used for marketing purposes? I mean, there's a lot that you could, I mean, they all sound like great things. And maybe it's just me. Maybe I'm the only one that thinks that there should be more information on this.
I think that some clarification should be there. I mean, I think that the clarification will be available. We can definitely request the presence of Marta Velez in our next meeting if we decide to go ahead and move this forward. If it's not, we have two options. We can table it at this level, wait for the vaccination rate to be increased within the Hispanic community, and wait for that information to be provided to us. That's not a problem.
But through you, Mr. Chair, I think your argument there is a little bit too much, right? Like
if we keep it out here.
No, I mean, because I think, but we still have a role to do, and I think it's a role that you appreciate and that you understand that role as well. And I think that when things are being brought to this committee and to other committees, they should. These things should be better explained. We don't have anyone in front of us to even talk us through it. Usually I say I want to see these things on paper. So we don't even have that. So we don't have a presentation tonight. and we don't have these document on paper. I can understand, the urgency, because it's an urgency that I feel. We both live in the same city and it's tiny, and we understand the importance of increasing vaccination rate. But I don't think that one trumps the other. I think, we have a fiscal responsibility for the city, for the residents, and part of it in creating transparency is understand what we're voting for. So if we're going to be voting yes to this, at the moment, neither you or I can articulate how $1 million is going to be spent. We can say to hire people, we can say for marketing purposes, we can say to lower the gap. But those words don't really mean anything. There's no substance to it, because I can't say that X amount will be used for, or even half will be used for hiring. Like, there's just nothing like that. So I just want to make that clear, because in your statement, it might lead others to believe that if you don't want to move this up, that it's because you want the gap to increase.
Well, on my statement, it says that the $1 million is going, as soon as we pass the $1 million, it's going to be used to increase, to reduce the disparity between the Hispanic community in terms of the vaccination rate. That's how the money is going to spend. And as soon as we approve the money, it's going to be used for that purpose. So we can keep it here, not an issue. I just wait for a motion from one of the councilors.
I will make a motion to table.
Motion to table.
Second.
There's a motion on the table, properly second. I call the roll call. Mr. Payano.
Yes.
Ms. Levy.
Yes.
I vote no. So motion passed. So we move forward with the next item on the agenda, which is item 17521, permission for the city council to pay prior year's invoice for the Massachusetts Municipal Association annual meeting trade show 2020. And this is for the amount of $304. It was put together by Councilor President LaPlante.
Motion approved.
Motion to approve has been made. Can I hear a second? Properly second. Discussion. There is none. All those in favor, I call the roll call. Councilor Payano.
Yes. Aye.
Councilor Levy.
Yes.
I vote yes. So, councilors, and there is no more items on the agenda as far as I know. I believe those two table. Give me 1 second, please. Yes, I think that those items that are on the agenda has been tabled from before August 3rd, 2021, August 3rd, 2021, and then May 18. So there is any other item on the agenda that we would like to take out of the table matters? I hear none. So, councilors, what's the motion?
Motion to adjourn.
Second.
There is a motion to adjourn, properly second. Councilor Payano.
Yes.
Councilor Levy.
Yes.
I vote yes. Thank you so much. Thank you, everybody.
Have a good night.
Councilor Rodriguez, it's
Sure.
great to see you. I